one. And Paula, thank you for bringing that up. I'm going to have Hugh do a welcome, and then we'll kind of get started on the Capital Chat. So thank you everybody for attending, and Hugh, take it away.
Okay. Hi, I'm Hugh Kelly. I'm the Vice Chair-elect of the DD Council. I've been coming up on not quite 6 years on the council so far, and we're glad you're all here today. We're gonna talk about, welcome to today's Capital Chat. We're gonna talk about the latest goings on Capitol Hill in terms of what's happening with the impact on people with developmental disabilities. And the main thing one thing I kind of like about the Capital Chat is I think it was 2 Capital Chats ago when they're talking about the Health and Human Services budget. I reached out to my two state legislators, and within an hour, I got a personal response from my state senator, Kevin Keeney, which I was pretty happy about that, to get a positive response like that. So we're just going to welcome, glad you're all here today, and at the end of our chat, there'll be time for questions or comments if anyone has any. And I'm glad you're all here today. Thank you.
Thank you, Hugh, for kicking us off. We're going to get started. Amy's going to share a PowerPoint, and Brady, I see you have a hand up, but that will kind of lead me to, we'll go through the PowerPoint, and we'll go through some of our key talking points, what's happening at the Capitol. We know that it wrapped up last night very late, and Amy will kind of talk a little bit about that. And then if you have questions, please put them in the chat, and we'll both try to monitor them. And then we'll get to questions kind of at the end, and make sure that we've designated some time. So again, thank you everybody for attending, and it's been a busy legislative year. And I know Amy probably pulled out of the parking lot from the Capitol last night sometime way after midnight, and celebrated a lot of success that had happened, but also probably left with some things that she'd like to see continue to move forward. So I'm Bill Collisted. I am the Public Policy Manager with the Iowa Developmental Disabilities Council, and this is our monthly Capitol Chat where we look back at what's happening at the Capitol, what has occurred, and then also we kind of look forward to what might be happening over this next year and this summer, and where to lead us to. So I just want to pause. Not everybody was on, but Paula Conley was on the phone call, and she talked about Katie Beckett, and her mom had recently just passed away, a longtime advocate. And if you're connected with the Iowa Developmental Disability Council, that is what we're built on, is self-advocates, family advocates, people speaking up on behalf of Iowans and people in the United States with disabilities, and trying to change what happens legislatively through policy, to try to change what's happening through systematic change, so that services can be better and lives can be better and people can live the fulfilled life that they should have. So let's talk about, it's a wrap, and the session ended last night. There were a number of bills that were signed into law, and there's a list of them there, from language development for children with hard of hearing, defining autism as a mental health condition, allowing a person with permanent disability to receive child care assistance, allows OTs and PTs to sign documents are required for accessible parking permits, keeps law enforcement reports about a person in crisis to be confidential, special education task force, private school settings, and newborn screening panel updates. Two that I'm going to highlight just really briefly is the first one, the special education task force and private school setting. That was one that we had a number. Amy, maybe go back one more real quick.
Oh, I didn't mean to do that. Sorry.
Sorry.
I'll get it there.
Okay, and so the one with the special education task force, that's a bill that's not tied to kind of the bill that was in the paper quite a bit in regards to school vouchers. This was around a family advocate who had 3 children in a private school that was trying to seek some additional supports for her child in the private school that had a disability. In order to get those services, they would have to have their child go to the public school. And so just really working on that. And what the Senate decided to do was put together an educational task force where they can review that and make sure that people have access to special education, whether that's at what should that look like and what should be the rules that follow that. The second bill, the Senate File 2345, is in regards to newborn screening panel updates. And that was really led by another great group of family advocates that really wanted to put some legislation in place to support newborn screening so that they could find out if a child was going, what kind of support needs they would have going forward. And the statements by parents at the committee meeting levels were really powerful, talking about if they'd had that screening or when they did get that screening, what changes and what kind of support that child would receive in life, and really positive. And so we see those as successful bills that move forward in law. Okay, Amy, the next one.
Yeah, and I was going to also say, technically, Bill, the session ended this morning at 12:10.
Sorry, yep.
I did that slide before they actually adjourned, so.
So there are 4 bills that are with the governor, and as we always try to encourage people to be advocates, if one of these bills rings out to you and you want to send some information, you can go to our Take Action Center and send that to the governor and say, hey, I'm really interested in supporting this bill, or here's my questions about it. But it's always an opportunity to advocate, or you could do that through your legislator still. But there's 4 of them there. Prohibits COVID vaccine mandates in schools and childcare centers, sets tiered rates for psychiatric inpatient based on patient acuity, mental health professional loan repayment program, and makes financial exploitation of a dependent adult or an Iowa crime. So those are all with the governor. They could be signed into law. That previous slideshow, all of those have become law, and so they'll start to be implemented. Amy, any comments on that one?
No, I would just say that, I didn't put all of the budgets here, but all 10 of the state budgets are also not yet signed. I mean, they're going to be on their way to the governor's office too. But I know we went through these quickly, but we did highlight a few of these in our April chat. And so if you go, hopefully by the end of today or tomorrow, midday, I'll have all of the bill tracker that's on InfoNet Iowa. You see the link down there. I should have all of the definitions and explanations updated. The amendments that they offer on budgets are about 70 pages long. And so it takes a little while to just make all of those updates in the tracker. So hopefully by the end of the week, you'll have a completely accurate bill tracker, but the status is all updated. It's just the definitions may be a little bit off right now, depending on how much they were amended. But we should.
Thank you, Amy. So there were a number that didn't make the cut, right? That maybe we advocated for, or maybe you individually advocated for, or that maybe you had questions about. And so here's a list of ones that we've been tracking and we've been reporting on, either in our newsletters or on our bill tracker that Amy pointed out, or even in our conversations, capital chats. Any ones that you want to highlight, Amy, and comment on? Oh, 1 second.
I had to unmute myself. Sorry. A little slow this morning with the lack of sleep. No, I would, one thing I wanted to note is there were some really serious concerning changes in the election law bill, and in particular requiring people to put their voter verification number on their absentee ballots. So some people may think that their voter verification number is their social security number. And if they put that number down, their ballot wouldn't count. And with such a short early voting period that we have now, the auditors were concerned they wouldn't be able to reach the voters to get it changed in order to allow that to count. And so we were really concerned about that and the confusion that would lead to. But in the end, that bill did not pass, and it didn't end up in any other bill that did pass. So that's good news. I think a lot of groups who are concerned that more restrictive voting would be most difficult for people that have challenges with transportation and staffing and all of that. We were really concerned. I would also mention that some of the bills that had been really had more of a push last year than this year, but they were still alive, was that public assistance oversight, which would have added a lot of paperwork for people just to keep their Medicaid or other benefits. It applied to food, the food stamps or family assistance. There was some concerns that if people weren't monitoring their mail really closely, or if they had somebody else that received their mail, that they may not be, they may end up kicked off of some of their benefits. So that bill didn't pass, but I think the hardest one, Bill, was that House File 2459. There was money in the education budget, $200,000 that would have accompanied this bill to provide scholarships for individuals with intellectual disabilities, developmental disabilities, or learning disabilities to be able to go to college, a college program. It's a post-secondary transition program. So I know some of you were on the call last month and had actually gone through the REACH program at University of Iowa. There's also a 2-year program at Northwestern College, and unfortunately that was taken out of the budget, and then that bill was not brought up. So it's something I think that people might want to look at for next year, if that's something that's important to you, or if you've been through the program and share those experiences with legislators. I think it may stand a good chance next year.
Yeah, Amy, and I know we've got one more slide on bills that didn't make the cut, but that's a great reminder. I know that we have a council member who's been through the REACH program at University of Iowa, and right now there are not educational scholarships that, there's scholarships available for all people that are trying to pursue a secondary education, but this would really be earmarked for people with disabilities. And so if you're interested in that bill, that's kind of the call to don't give up, this is the perfect time. They're going into summer, they're going to go towards a primary election and then the election season. A great chance to reach out to your own legislator and say, hey, I saw this bill, this is something that means something to me. Or if you're, opposed to it too, either way. But this summer, these bills, even though they didn't make the cut, sometimes it takes a number of years. And I know that we sat in on some bills that were passed this year that had been in the making for 10 years. And while we'd like to see progress sometimes faster than that, sometimes to get everything right, it takes a while, because once it becomes a law, it's hard to change. So they are very prudent about that process. I just wanted to make that comment. You can reach out this summer in regards to these laws. Just because they didn't make the cut this year doesn't mean they can't be carried forward. So
yeah, the legislators will have to refile them. So in a 2-year cycle, during that 2 years, from the first year to the second year, bills will carry over. But I would expect that some of the legislators that were supporting some of these bills will refile them. I know that Bill Stumpf, who was on the call before, was really involved in the guardianship bill, and he was involved in one of the 10 sections of that bill. And I think the other 10 sections were really tough to get past. So I'm sure that'll be up next year. It seems like it is every year.
yeah. So we should go to the budget, and I know there's a lot of detail here and a lot of final decisions. That's usually the last part that gets finalized, and that's what usually takes that extends the period. So do you want to kind of highlight some big ones for us when we can?
Yeah, I'm going to just highlight the 2 biggest parts of the budget, which are the education budget, which is the second largest at almost $1 billion. And then the next one will be the House Health and Human Services, or the Health and Human Services budget. I don't know why I wrote House on there. Just ignore House. It is the education budget. It's a House file. Again, I did this in the middle of the night last night, so I apologize if I have some mistakes here. But it is the second biggest at $1 billion, and then the Health and Human Services budget spends $2.1 billion. So that makes up about 2/3 of the budget, state budget. And of course, that's just state money. Both budgets draw down federal dollars too. So that's a really big chunk of money. The education budget, we were excited because I know that Bill and the DD Council work really closely with Vocational Rehabilitation Division, and they were able to get a $120,000 increase, which draws down additional federal dollars for those voc rehab employment programs that they provide. So that's really good news for them, because they haven't had an increase for quite a while. It also included, that's not right, it's not 1.3 million. I'm really having a problem here. Oh yeah, no, sorry. It is 1.3 million for rural healthcare professional loan repayments. So those are programs that help get nurses and doctors and specialists out into those rural areas. And they repay their medical school loans. And then we're excited that there is a brand new $520,000 mental health professional loan repayment program. So that is the first program that provides repayment for their college loans for non-prescribing mental health professionals. So that'd be social workers, psychologists, marriage and family therapists, mental health counselors. All of those have never had a program to help them repay. It is specifically designed for shortage areas, but right now only 6 counties are not shortage areas. So I'm wondering about Glenwood, because Mills County, where Glenwood is not considered a shortage area because of the State Resource Center being there. So with that closure, they might actually open up to be able to get some of those mental health professionals. But and then the AEAs, area education agencies that provide school-based mental health services, got an extra $200,000 for their work. Best Buddies, they had some people that were participated in Best Buddies at the Capitol to testify this year, and they got an extra $10,000. And then they also require the school district where a child resides reimburse a charter school for special education costs, so they can make sure that special education is provided and funded in that charter school environment. I guess there was some confusion about that, so that's more corrective. But the bigger budget, there is a lot here. And I'm just going to give you some highlights, but I want to talk about a few of these that really are kind of linked to Glenwood's closure. They are definitely going to they added funds to both Glenwood and Woodward to replace some federal match that they lost. So it's not really an increase, it's just replacing the federal funds they won't have. But they want to make sure that those are adequately resourced, make sure they have the money they need and the staffing they need to provide good services there, so that they don't have further issues with the Department of Justice. But they also wanted to start investing in some of the home and community-based services. And when I get to the next slide, you will see where some of that is. We had talked about some money for waiting list reductions and reimbursing the staff at a higher rate that provide home and community-based services so that their wages would go up, and we could hopefully address recruitment, retention of staff. Those were pulled from the budget in the compromise, but the Department of Human Services is going to use federal ARPA dollars. So those are the dollars that came in from COVID to pay for those services. So I'll get to those in a second, but a few of the things that were in the budget and are going to be paid by Iowa taxpayer dollars are an increase in the intermediate care facilities for intellectual disabilities. So that's the ICFID. They increased their rates by 1.4 million. They were going to get a $3.1 million increase. That's what the House wanted, but what they ended up with was 1.4 million. So that's supposed to go directly to wages as well. There's an increase in home health care providers in rural areas that are being really hit hard by the rising costs of gas. So increasing those reimbursements will help make sure that that is a service that people in rural areas can get. Bill talked about the psychiatric inpatient tiered rates. That's paying a provider more for people that have more complex conditions rather than a flat rate for everybody. That would help people picking and choosing who they want to serve and leaving the highest needs left out. So they're increasing those rates for individuals that have autism. The applied behavior analysis is really important, and so they're increasing those rates. The BHIS, or behavioral intervention services, those rates are getting increased. That's for kids that are usually in psychiatric institutions, but those reimbursement rates are going to be increased. They're adding psychiatric residencies, so they're going to add 2 in rural areas and 12 in the state mental health institutes and at the resource centers, at the boys training school in Eldora, and at the correctional facility in Oakdale near Iowa City. So they're going to add more psychiatric residencies, hoping that those people that go through the residencies will stay in Iowa and provide services. So you can kind of see all of this. There was a lot of language in the bill that helped allow the Department of Human Services and Department of Public Health to merge into the Department of Health and Human Services. There was some cleanup language on the mental health and disability services regions. It really wasn't significant, but it was a lot of changes from the initial language. Talked about what you had to do to become a region. Now that we have regions, it just needed to kind of clean up to match what's happening right now. And then you can see that they did not require insurance companies to pay for kids' hearing aids, but they did allow money that wasn't spent on hearing aids. There's a grant program at the state level that people can apply for to get reimbursement for those costs that aren't covered by insurance companies. It wasn't all used, so they're just going to make sure that that money doesn't go back to the state. It stays in that program. I do think it's important to note that they added some language at the end that changes how admissions happen at the mental health institutes or MHIs when a person has an ID diagnosis. This is making sure that individuals with intellectual disabilities are not over institutionalized. So right now, any provider can say that a person meets the criteria to be admitted to a state mental health institute. The new admissions criteria would require the DHS director or the MHI's I can't remember, do they call him superintendent? I can't remember who the lead is there, but the head of the MHI are the only ones that can determine if somebody meets the criteria. So they will be the ones that make that final determination, and they get to consider whether they have the capacity to serve them appropriately there. It also changed the definition of intellectual disability, which I was a little concerned with at first, and then I read the old one, and it's really old and references outdated terms. So it does clean up that definition in that particular section. I'm going to talk about a few more on the next slide, and I can go back to this one if you have questions on that. But these were things that were taken out of the final compromise. But as I noted, a couple of them are going to be used to pay with federal funds. So you can see some of the stuff that got added back in, but there is still money to increase the home and community-based services waivers. And that includes the consumer choice options. It includes habilitation. And so that money, that $14.6 million is matched with federal dollars. So you can almost multiply by 3 as to how much that will increase. And that will is supposed to be used directly to raise the support staff wages. So the provider isn't going to get the money. It's the actual people providing the services will get that and see that as a wage increase. They are still adding dollars to remove 250 people off of the ID waiver waiting list. There are over 5,000 people on that waiver waiting list. If that puts that in perspective, how much it would cost to clear it. The concern I will say with this is, while you can celebrate the fact that they are doing this and this will increase capacity in the communities in a way that's needed as we transition people out of Glenwood, the ARPA funds are only available for 2 years. At the end of that 2 years, to keep rates up, they will have to add that with state dollars. That's about the same time that our Medicaid surplus that we have, because the extra money we have in Medicaid right now, because of the enhanced match rate from COVID, that's about the same time we'll have to replace those federal dollars. So in 3 years, we're going to have a challenge. The state will have a challenge in trying to add in those monies so it doesn't become a cut. And I think that's why the House really wanted that funded with state dollars. I'll also remind you, we passed a massive tax cut bill this year that's $1.6 billion will be out of cut on taxes over the next 5 years. And that will really be hitting in 3 years. So it's kind of a perfect storm there that I'm really happy to see that this happened, but really, really nervous because I'm not going to be retired in 2 years. So that means I'm going to be back trying to make sure that they have the money to keep this commitment to people. And I think that I have to bring that concern up, that the way they fund things is often as important as how much they fund them.
Amy, that makes a lot of sense. And I just want to say it maybe one more time so people kind of understand it, is just that right now, the way that was taken out of the Health and Human Service budget, which is part of DHS or part of our state budget, there is this federal money right now that's available, but it's kind of one-time money. It's right there just for, and because there's some other changes happening at the state level in the next few years, they're going to have a different solution. Right now, this is fine. It's kind of like getting a $5 loan maybe from your family, and you can use it right now. But if you're not having other income come in, that could be a problem. And so I think that what you're saying is we'll have to keep our eye on this, and there will have to be some advocacy to make sure that these levels of support, whether it's for direct support wages, whether it's for long-term care, or addressing the waiting list, which we know is really large. It's one of our advocacy points. There's right now 17,000 people on the waiting list. We're still trying to work on that piece of it. So you can see how expensive it is to get 250 people off the waiting list. Yeah, and I can put in the chat the American Rescue Plan for 2021. There's a website Iowa Medicaid has, and we'll just continue to put that on our website so people can kind of follow. They do a great job of updating it. They've had the information meetings for DHS, both for families and providers, where they kind of keep us in tune with what's happening. But as you're saying, this is a good solution for now, but we should continue to advocate for what's happening here as we go forward.
Yeah, and I just want to say the House, so the state representatives were really strongly wanting to keep this in the budget, like not using one-time funds for ongoing expenses, like you said. The House, that was really important to them. It was the Senate that wanted to spend less and use the federal dollars first. So, I mean, it is a little different when you're talking to the representatives versus the Senate. It was really I'm just going to blame the Senate for that, but the House really had a great budget. I mean, there's a huge wait list for substitute decision-making services. And I know that's a really important issue for people. And that money was cut out at the end too. So there was a lot of things that just couldn't get funded because they had just such a lower budget amount available to spend in the Senate. They didn't want to spend all the money that they could. They wanted to put a little more in the bank. We've been doing that for a while. That's why we have $1 billion surplus, but
Yep.
yeah, that's just a philosophical thing with some of the people doing that. But I can't see when when I'm sharing my screen, I can't see the chat, Bill.
I've got it, Amy. We've got two questions. One, I can answer the first one for sure. Brady asked about, he had not heard of the Best Buddies program. And Brady, it's a program for high schoolers, the way I understand it, that offers the opportunity for people to be a part of the program, that offer one-on-one friendships, integrated development, even employment, where I know that the Best Buddy program at our children's school is, there's a group of kids that have disabilities and they're matched up with a person without a disability, and they develop a one-on-one friendship and either develop social things they're doing together or community activist things together. And there's a national program. So I included a link there that kind of connects you to what it is. I know.
Yeah, I looked at it.
Okay. At Roosevelt High School, where my kids went, they started an integrated bowling league, and now there are state championships. And actually, two of the people that started it have actually went international with that as well. So it's a pretty cool program, obviously. And then Amy, we had a question about speech therapy, and it said there are rate increases in there that would allow kids to get therapy from providers that require higher rates. So it sounds like there's a gap. There's the Medicaid cost, maybe it's $10, and then the therapist agency might require another $5 on top of that. Is there anything to shore up that gap? Did you see anything in legislation that might?
I don't. The thing is, I think I saw something earlier in session, but now I don't think it made the final. I didn't see it in anything, but I will be rereading it. So if we do find it, we'll make sure we highlight it in our reports. Or if you see it, email it to me.
Yeah.
Was that it then?
Yeah, and then I mean, there's Chad had commented that just about that still services are not always effective for people, and you can increase the rates of staff, but if they're not meeting the needs because of the loan reimbursement need, it's difficult for families. And we know, there's a lot. I think there's a lot to clean up in regards to services being provided. One of the things that we've been advocating for is the continued investment in home and community-based services, whether that's that therapy need that you're referring to, Chad, or whether it's even HCBS services where you're getting supported community living or respite, or just even community options. I met yesterday with an agency out of Muscatine, and they're working on a lot of, they're already investing in their staff and their services with the anticipation. I think some of these rates are coming through. I believe they're from Muscatine, but just the idea that they're still trying to invest in those services. So that makes it, there's the macro that the money will come through, and then there's the micro of how those funds came through. And I know one of the questions that came up, I think 2 capital chats ago, that bullet right there, that $14.6 million going to direct support wages, there was some concern that those dollars would find their way actually to the staff. And we have now 3 years, I think, of track record where that money has been designated for direct care providers, and that has flowed through directly to them. So from that standpoint, we were able to provide some assurance that's happening. So.
Yeah, and we did hear from DHS that it applies to anybody regardless of their title. So it's not just those that have like the direct support professional title. It's just anybody that provides direct one-on-one support, and that could include a supervisor that takes shifts or has done lots of shifts. and filling gaps, because I think that the issue is that legislators realize that there are gaps in services, and then they need to fill those gaps. And then they realize that the demand is higher than the capacity of the people that are providing the services, because there's just not enough people to do the work. And, when you're paying people less than what Target or some of the fast food places are paying, it's hard to get people to do the work when they can make more money going to Walmart and working. So I think they were trying to address that piece, where maybe you can keep people in those roles and not leave the profession while they try to work out the rest of the things that are happening. I think there's just, to Chad's point, his comment today, and then before in the previous chats, I think that schools are still going to be in for a lot of pressure. And even though education reform didn't pass this year, there's more and more expectations on schools, and teachers and superintendents and principals are retiring because of it, all of the new pressure put on schools and everything happening, that I think there's going to be a focus on that quite a bit. So Bill, I think we will be paying close attention to that special education task force this summer to see what they're talking about and where they're moving, because special education is one of those things that everybody talks about when it comes to charter schools or private schools. How do we guarantee kids are treated equally regardless of where they're getting their education? And so that's just
Amy, we have a question from Hugh, and he said, is the state going to start mailing out MEPD statements in the near future? And I don't know that acronym. That's not clicking with me. You maybe you know what that is, Amy.
It's the
Medicaid eligibility for
Oh.
people with disabilities. Sorry.
I should know that, shouldn't I? You, sorry.
Yeah. Is that, oh, sorry. I just clicked something. I meant to hit stop share so I could see everybody. So yes and no. I'm trying to remember what Liz Matney said in a meeting that I was at a couple weeks ago. They're getting ready to start preparing people for what's going to happen when, well, let me back up first, Hugh. So for everybody to know, Medicaid wasn't allowed during the public health emergency to disenroll anybody, regardless of whether they're eligible or their circumstances have changed. They weren't allowed to disenroll them. And so while the public health emergency continues federally, Medicaid can't kick anyone off. And so right now it looks like Medicaid has grown a ton, but once those things start to happen and people, maybe they might have a job now or got a pay increase and are no longer eligible, or something has changed in their life. They'll at some point they're going to have to start sending out letters about eligibility, and you'll have to have your paperwork prepared to be able to show that they were in error or something if you get one of those letters. So I think what they're planning on doing is they're meeting to talk about how they're going to do that and when they're going to do it, so that people aren't freaked out when they see the letters, and that people know that it's coming and what they will need to show. So I think Liz Matney's got a meeting planned at some point, a public meeting to talk about that. When I find where that is, I know I got an email on it. So I will put that on our Facebook and in our next report. I'm making a note to myself so that you can, if you want to attend that, you can.
Okay, thank you.
I think they're trying to get people ready. They don't want to freak anyone out.
Yeah, I just haven't, I used to get regular billing statements and I haven't gotten any probably for close to 2 years now. So I was wondering what was going on with it.
Yep, that's it. It's because we're still under a federal public health emergency.
Okay.
Amy, did you see Jen Wolf's comment?
No, I'm just now looking at the chat, so I had to stop sharing.
She said there's a meeting this afternoon. Jen, can you post that in there? I'm trying to look up that too as well.
See, during session, the last week of session, I see things and then I can't remember when they are.
Yep.
Chad, I don't know who's on the task force because they just signed it, but we'll let everybody know when I do see that. And Consuela said, did you see the news on the CCA school lawsuit? I have not. I really need to catch up on my news too. I don't know, Bill, if you want to say anything else, or you want me to show the dates or reminder on the elections, or does people questions before we?
Well, I think that I just want to do, I know I do a recap on this all the time, is that you can see from that PowerPoint, which we'll have on our website, the bills that have been passed and the laws that will become laws. And you can see the ones that are out there as an opportunity for advocacy. And just remind people that our Infonet website, which I'll put in the chat, is a great way to track and follow bills and to also connect from an advocacy standpoint. We do have a link there that you can, like Hugh said in his opening, you can directly contact your legislator and share your opinion on those specific bills. However that is, our job is to kind of inform and make sure we know where things are at. We also, in a month from now, this is the Capital Chat for May. In June, we probably will do a deeper recap of the session when we really also kind of forecast what we think is going to be happening the next year. So that was really my point on that.
Wait.
Thank you, Jen.
This that was posted for this meeting, is this the one with Elizabeth Manny and them?
Yes.
And that's from 11 a.m. to 12. Is that going on right now?
Yeah.
Oh, yeah. It's done.
They're done?
Yeah.
That was from 11 to 12, so it was 2 hours ago.
Wait, it's only, oh crap.
I know.
Typical, right? This is how we get away from that.
Yeah.
We had a meeting. It was important yesterday. Here's the link.
Yeah, I think I think that they will bring it up in those monthly Medicaid member meetings too. If you go to those, I think that's a good time to talk about that or ask that question. And Jen probably knows when that date is. I don't have it off the top of my head. My schedule's like a nightmare, but
Need some help? I'm available. I work for free.
it's this Thursday. I knew it was is it the last Thursday of every month?
It is Thursday. Yep. Jen said it's just the Medicaid town hall meeting. Have you guys had an opportunity to attend those?
Well, which ones? Medicaid.
The Medicaid town hall meetings.
I haven't seen one that was coming up, so I'm curious. I'd like to.
Yeah, there should be one. I think what Jen's saying is tomorrow. I'm trying to find it on
Yeah,
the
4
website
to
here real
5.
quick, and I'll put it.
They're 4 to 5, aren't they? Or is that the members 5 to 6? The providers are.
Yep.
Here, I'll post the link here.
I'll get on to
Okay.
Derek. We'll see if he answers.
It's a
Pretty
good,
responsive.
well, you sign up, they'll answer, it's an hour and they'll answer any questions. Liz is on them directly. So they're a really good time to get information, but that might be a good time to ask that question too about their.
Okay,
plan.
thank you.
I probably better get that on my calendar, Bill.
Yeah, same here. I get into that Medicaid website in there and I start to follow one track there and then it gets turned around. So
Like an IEP meeting.
I agree, Tucker. It'd be great if their meetings were easier to sign up for. One thing that we do try, I think for every meeting we have posted, sometimes we're kind of late to we're really late to the meeting that happened today at 11 to 12. We didn't get that posted, but I think for most of those parent meetings and provider meetings, we've posted those. So if you have the opportunity to follow us on Facebook or also on Twitter, we put those out there, but we also send those in our emails. Sometimes we have a lot of material in there. Amy's been doing a great job of at the top of our infinite emails, kind of putting things in bullets first, so then you can kind of click on it and then go to that section. So
yeah, that link that I set there is, you might just want to bookmark that, because that is where they post all of theirs meetings, their town hall meetings, member meetings. And so the next one's June 23rd, but after tomorrow's. But I'm literally signing up for mine right now because I forgot. So they're signed up now.
Yeah.
You guys have other questions or things you want to ask about? It was kind of I mean, I will say this session was very focused on community capacity. I don't know that it necessarily, you can see that in how the bills turned out, but really after this, I've been up there for 30 years and I have never, I mean, this was a very focused on mental health and community capacity in all of their discussions. So I think, congratulate your legislators for doing something and encourage.
And I think Amy also, and I don't have that 30-year experience. I'm a lot younger. No, I was gonna we're the same. I'm older, but I was gonna say the other thing that we saw there was some student repayment loans, and we also saw some advocacy for rural areas. And I don't think I was in a committee meeting where they were talking about direct support wages, about their concern for people being paid enough, whatever that was. And sometimes there was action and things move forward, and we're really, like you said, let's thank our legislators for that. And sometimes it got stalled out, but it doesn't mean that it can't be brought back up again. But there was also a lot of focus on rural areas. And I think that, for myself, who's from Des Moines, sometimes we forget that part, but there are a lot of our advocates, there's a lot of our self-advocates that live want to live in their own community, in their own home, and in their own area. So we want to make sure that that any part of that is positive. So yes, Brady, your hand is up.
At the beginning of the meeting, Hugh said that he's going to be the new re-elect vice chair. I do want to let people know that starting in July, I'll be taking over as the chair for the Iowa DD Council. And I really am looking forward to continuing to work with Bill and Brooke and Hugh and everybody else on the DD Council. It's a great opportunity for me to take a role model role and try to advocate and assist with different things happening on here in Iowa. I don't know if this is appropriate place to say it or not, but the Make Your Mark conference is coming up in September, and they are also looking for suggestions for this year's Mia Peterson Award, a self-advocacy award. So if anybody knows somebody in the state of Iowa that goes over and beyond just to advocate for people with disabilities, please reach out to the DD Council, Bill, Brooke, Lindsay, or myself, and we can help you get that paperwork filled out so you can nominate people. So I have, I think, one or two people I'm going to try to nominate myself. So I just wanted to throw that at you guys too. So thanks.
Thank you, Brady. And we're looking forward to your leadership. Brady did a brief dry run at our last council meeting. A few times took the chair over, and he's going to be an amazing advocate. And with Hugh by his side there as vice chair, it's going to be a powerful year, right, Hugh?
Right, correct, Bill.
And I don't see her on here, but Judy Ward, she's also on our DD council, and she works for the Iowa Youth Said, and Judy has stepped up to kind of be my sidekick with me taking over as the chair for the council to help me if I need help with anything. So I just do want to thank her and the DD Council for allowing her to help me through this. This is a great opportunity for me to really, step up my game with the DD Council and continuing to advocate for people that need it. So,
Thank you, Brady. Judy will be honored. So Chad, you had a question, and then we have one last point. We want to talk about the upcoming primary. So go ahead, Chad. And
not really. I just, the flexibility, like for when there's not providers available. I don't know if there's anything talked about this. I mean, because obviously we do have that problem with providers or distance, or I mean, the pressure to go back to work, but also to find the proper care for these kids. And I've talked to Elizabeth Matney a few times about this stuff, and it's been a while. But about flexibility, for instance, if we're not using money to get services, can it be used for something else to I mean, just in order to keep a family from becoming, you know, I don't know what the word would be. I mean, dislocated, homeless. I mean, because it's like what do I do? Go to work? I have no way to do it with my kid the way it is. Or, can we find a way to compensate me somewhat? I mean, I don't know. Has anything been talked about on that area, I guess?
I think there's been a lot. I mean, especially with the pandemic, there's been some response to flexibility of service, whether that's teletherapy in regards to the mental health side of it. But I also think, Chad, I was just talking to a provider the other day, and they are a disability provider. They're actually from a different state, and they are half of what they were 5 years ago. And so they used to have 41 apartment type setting, HCBS community-based setting homes, and now they're down to 20. They used to have 600 community-based staff. Now they're down to 300. But he had just secured an endowment where they were going to start investing, hoping that, and this is a different state, that state's legislator will follow in there. And I think flexibility has got to be a key piece. And I've heard HCBS or Medicaid talk about trying to figure out how to be flexible. Some of it's been that, the example that comes to my mind right away is the teletherapy. But I know that, we've done a lot of advocacy in regards to recognizing the amount of service that families are providing. You put something in your chat earlier about families being reimbursed. I was on a national call with other DD Council public policy people, and they were discussing, there were different states that have come through with some solutions for family reimbursement. There are some, families who would rather providers get reimbursed and that they can be parents, and there's some that would like to be recognized for what they're actually providing service. So I think that flexibility point is something that really, those family meetings, those town hall meetings would be a great chance to advocate for that piece and getting a list and giving suggestions, because I think that they're open. Everybody's being challenged by the staffing significant crisis or the lack of providers, the way that the volume that maybe we had a year ago or 2 years ago. So, it's a time to come and be brave with those solutions.
Just one quick thing to that. So, with that said, all right, well, I'll skip that. The compulsory attendance, has anyone heard anything about that when it comes to special education? Or, am I the only one that's had to deal with this stuff as far as letters from the school talking about, notices about, my kid, for instance, missing for doctor's appointments, or sleep issues that I've had to wrestle with. The unintended consequences of these things, for instance, in an unmarried situation or divorced, can bring you back into court. it just seems so unnecessary to me when we're talking about these kids. And I don't know if anyone else has heard anything about this.
I can tell you that there was an effort to change the truancy laws, so that kids that have this person, I know this group was working on specific to autism, but I think it would apply, they were going to make it apply to a broader,
Just,
if
yep.
somebody's going to a therapy appointment or a mental health visit or something like that, or a doctor's appointment or something related to they're missing school for something related to their
Just-
diagnosis, that they wouldn't be, it would be an excused absence. You wouldn't, there wouldn't be an issue with the truancy stuff. And I know I have a kid with asthma and she missed a lot of school when she was younger because it was not as well controlled. And we got those letters too. I mean, they're
Yep.
scary too. They're not only that, they're scary, but what do? You can't send your kid, or if you like during the pandemic, I mean, can't send your kid to school if they get a fever for a day. So, I think that is, I'm reading Consuela's comment that cannot not be written into the IEP or the 504.
This is Paula Conley. Actually, we usually put those in the healthcare plan if there's going to be a lot of school missed. And again, that doesn't prevent the letters from coming, but it protects you because you've informed school that, these things are related to your child's overall healthcare plan. And for some reason in Iowa, they don't do it like this. In other states, your healthcare plan it's a part of your IEP, but it's not your IEP itself. And in some states, that's actually your IEP. That's not here. But anyway, parents can put that in the health plan when they sit down to do those plans with the school nurse.
The problem with that is there's no protections. It's not backed by any kind of law, any procedural safeguards or nothing. And this is why they're electing to go to those. And that's exactly what they tried to do to me.
Yeah, I think Representative Shannon Lundgren will be working on that again next year. See, that's somebody you might send a note to, or I can bring that up too.
I mean,
yeah. And Chad, I will tell you this, I have accompanied many a parent to a truancy hearing, and most of the time, and I'm not saying all counties are like this, but the majority of those county meetings have been kind of helpful to families because the conversation isn't punitive. It's more, how can we help you? We recognize that there's a challenge here, and why schools are so concerned is that there is a direct correlation to the amount of school you miss and how well your child does. I'm not saying the school's approach is always the right way, but what they're trying to do is to help. And like I said, I have been to well over 100 of those, and we've always been able to work things out in a really positive way, including helping getting additional supports to families, because there are kids who refuse to go to school. And, if your child is in 10th grade and, it's twice your size, could be difficult getting your child to go to school, and they're looking at you and saying, no way. So sometimes, those meetings are helpful because you can talk about those challenges and get some support around that. So just again, that's not always a punitive thing. Sometimes that's helpful.
Thank you, Paula and Chad. I know this is a really important topic, so I don't want to shorten it, but I do want to, I know we have a number of people who are on who probably have to sign off here. We're about 3 minutes over. So I just want to remind people there is a primary election June 7th. Some key deadlines have come and gone. Your ability to pre-register to vote in the primary, but if you're a registered Democrat or Republican, you have to be registered in a party to vote in the primary. But that will be June 7th. If you have a ballot at home and you've requested your absentee ballot, make sure that's in. It's got to be, it's not postmark anymore. The law has changed. They have to receive it on June 7th. So if you have it, mail it today. If not, drop it off soon to your auditor. And and share your voice through voting. Also, there will be an election this November. So I
Yeah,
just want to take a,
just
go
one
ahead,
more
Amy.
thing on that. I just want to remind people, you can still vote at your county auditor's office, and you can do all the same day registration stuff there too. You can change your party affiliation right there. So you can do all of that at your county auditor's office still. We just, you can't do any of that by mail anymore. So I just wanted to note that, and the county auditor's offices are open the Saturday before the election. So that would be June 4th. They are open on that Saturday. So if you can't make it in before 5 o'clock on a weekday, that Saturday, it'll be open. So that's kind of nice. I always do that. I'm actually going to be camping on election day. So I will be doing that.
Bill, who should we vote for?
Well, thank you, Amy. Just to end with a thanks to Hugh for doing a great introduction, and thank you for Paula for making sure that we're communicating to everyone. But I do want to end with a huge thank you to Amy. She always collects all the information at the Capitol, and she puts it together in a way that just helps us kind of focus in on and what's happening and what can we do about it. And it's been there's been a lot of wins this legislative session when and as a number of the conversations we've had, there's a lot still to advocate for. So we appreciate everybody's attendance, appreciate your feedback. Please use our Infonet, and if we can do a kind of a virtual celebration for Amy. Thank you, Amy, for all that you do and make us look informed and keep us informed. So thank you. And we really like it when you're sleep deprived. You're even a little sharper, I think. Creating advocates, right, Chad? Thank you, everyone.
I'm
Thank you, guys.
Thank you.
I'm there.
Bye, guys.